Multnomah County has an ambulance problem. And over the past year, we've showed you what's wrong. Ambulances are often late getting to emergencies. In some cases, they aren't available at all.
Truck 4, copy. We're currently level 0. We'll get someone started as soon as they're available.
And when someone needs immediate help, that matters. The county's EMS provider, AMR, blames a shortage of paramedics and strict rules from Multnomah County that make it harder to staff ambulances. County leaders have threatened to fine AMR for poor performance. But finger pointing aside, what's being done to fix the problem?
We have a long way to go, but the project is looking very promising at this point and very safe in getting the right, appropriate care to people who are calling 911.
To get answers, we asked Multnomah County and Portland directors about their plan to fix this. They've made two big changes. First up, a new way to sort and manage 911 calls.
We need to get some of the volume out of the 911 emergency system so that those emergency resources can really respond to the emergencies, and a more appropriate resource can go to those non-emergency type calls.
The idea is a smarter management of different types of 911 calls can help keep paramedics available for the big life-threatening cases. Someone with a toothache or a rash can wait.
So does this now feel like a more effective use of that emergency dispatch system?
Yes.
At the city's dispatch center, Director Bob Causey says the new triage system could help reduce 911 wait times.
Yeah, the more efficient system we have, the fewer calls that are having to wait in the 911 queue, the quicker our call takers are able to get through all those calls.
The other big change is who is responding to 911 calls. AMR Multnomah County has now started sending teams of 2 EMTs, not as highly trained or qualified as paramedics, to provide care in lower-level cases. These are called Basic Life Support, or BLS crews. The goal is to get more ambulances on the street and reduce the overwhelming workload on Advanced Life Support, or ALS paramedic crews, that respond to the most serious cases. Right now, there are 8 EMTs staffing 4 BLS ambulances. AMR is hiring more EMTs, and the county wants that.
So I think you have to scale up.
Scale up to take pressure off the ALS paramedic crews, hopefully eliminating the concerning level 0 situations, when all ambulances are tied up and dispatchers have 0 ambulances they can send to an emergency.
Yeah, I think it's reduced the duration of the level 0 events, reduce the level 0 events, and then increase the availability of ambulances, and that's what we're seeing.
But big picture, will these changes solve the county's ambulance problems? AMR says it needs mixed crews, 1 paramedic and 1 EMT, to make things better. For decades, Multnomah County health officials have insisted that ambulances need to have 2 paramedics to provide the best medical care. The BLS program shows some room for flexibility.
I think we're seeing a need for more different resources than what we've historically had looking backwards.
But the county still says it has no interest in allowing a 1-in-1 model anytime soon. Both changes, the 911 triage system and the use of EMT crews, are active now. County leaders say they can't promise a permanent fix, but early data is encouraging.